these case studies that have been shared today just really demonstrates the great work that's happening across the east of England. It seems like such a long time ago, back in 2019, when we were in a very, very cold room in Queen Park's Rangers Football Club, launching the programme. And the main purpose of the regional networks was really to bridge that gap between national and local mental health and physical activity work, explore opportunities for collaboration, share best practice, but also identify needs on a local level too. And localised events like this have just been so key to kind of really achieving the aims of the programme. So yeah, I realise there's a lot on the screen there, but I think it just really showcases the impact of what's been achieved. Back in 2018, we developed co-design sessions for the sport and mental health sector. So we brought everyone together from the North, the Midlands and the South, and partners really showed us what they kind of want in terms of connecting on a local to regional level. And the regional networks were a result of this. So in 2019, we launched the programme in partnership with 8 hubs across England, Tom being the lead for the East of England. And then we moved to 2020, where we had the first face-to-face events. A huge impact on the South East, celebrated 100 members signed up to the network. And then we had the kind of pandemic hit and everyone had to really kind of move everything online. But I think the hubs have dealt with that really, really well. And today's conference just really shows the impact of online conferences as well. In 2020, we had 400 people trained up through our e-learning, and that number's only grown over the past couple of years. The original programme was for 2 years, and then we extended the programme because we just really, really saw the impact of, I suppose, on a national perspective, actually, what we were learning on a local to regional level. And that's really helped to kind of shape our work and our strategic objectives too. 2022 saw influencing of the health sector. So we had some really key work with the hubs working with integrated care systems and talking therapy services as well. We've also seen great support to our local mind network. And then we've come and jumped ahead to 2024 when we're planning the legacy for the programme. So myself and the physical activity team at 8 hubs have been really working hard over the last 8 months to say, actually, how do we continue this conversation? How do we ensure that mental health remains a priority on a local to regional level? The programme does come to an end in a couple of days, but that definitely doesn't mean that the journey ends. And the legacy of the programme really will ensure that we continue to work with local and regional clubs, and there is a point of contact to work with that. So in terms of impact, I've only included a very few snippets of what's happened over the last few years, but across all 8 hubs, we've engaged with over 2,000 sport, physical activity and mental health organisations, which is beyond what we even anticipated at the beginning of the programme. We've delivered over 50 events, which includes conferences like this today. We've trained over 2,000 people in our mental health awareness and physical activity training. Like I said, we've supported and we've seen such a great support for our local mind network. We've seen the introduction of new physical activity and mental health programmes, such as an Active Norfolk All to Play For, the great case studies that have been shared today, and more on a more England focused, but across the whole of England. With the introduction of mental health champions programmes. I think for us, on a national perspective, we've seen so many more clubs and organisations access our sector support offer and our universal offer. James touched on our toolkit this morning, but it's just been great to see how many local clubs have tuned into our webinars and our events as well. And then also, as mentioned, just the great working with the health sector as well, and really influencing the integrated care systems and the power that physical activity has in supporting people with mental health problems as well. There's been many unexpected outcomes of the programme too. So as you can see from the quote on screen, one of the hub leads from Yorkshire and Humber, she said it was a real privilege for her to kind of lead on that network. And it's not just a one-man band anymore. She's seen that Yorkshire and Humber, a lot of active partnerships and local organisations have joined in the fight and really helped to build that hub. But 2 years on, she's actually now a programme manager for the mental health within a NHS ICB, which isn't something she would have ever considered before being part of the hub. And I think it's just great to have someone who's had such experience in physical activity now to be influencing and embedding physical activity within that ICB as well. But before I hand over to Tom, I just want to say a huge thank you for delivering the conference today, but also everything that you've done to support the East of England hub and all the organisations over the past couple of years. I remember last year we were in person at this conference, and it was just great to meet so many new clubs and organisations and find out everything that they've been doing. But yeah, most importantly, it's good to highlight the East of England impact as well.
Brilliant, thank you, Karla. So I'm just going to run through some of the impacts that we've had in the East of England. So when we became the regional network hub, us at the Herts Sport and Physical Activity Partnership, we knew to achieve regional reach, we'd need to engage with various partners, because obviously, as our name suggests, we're a county-wide organisation. We started this by working through the active partnerships in the East of England, and over the course of the regional networks programmes, feel we've developed really strong relationships with the active partnerships in our region. So although HSP is the host of the network, it's got to the point now where it is very much a collaborative approach. So conferences such as today have been brought together between the active partnerships. Developing these strong relationships has ensured each active partnership is aware of the good practice and taken throughout the region and better connected with the organisations we can learn from. As we've seen at today's conference, as a network, we also do as much as we can to highlight the good work, helping ensure this learning goes beyond just us working within the active partnerships. Karla jumped ahead there, but we've also launched a mental health champions programme at our conference last year. So with this programme, we had access to Minds e-learning licenses through being a regional network hub, and we wanted to make sure that we could use these licenses to stimulate engagement and hopefully create a legacy beyond the regional network. We wanted to do this by creating a group of individuals within the community that could continue to advocate for the importance of being physically active to support people's mental health, but also so that they could look to make activities more inclusive to those with mental health conditions. I'm just going to quickly reflect on the Champions Programme because that's something that people might still want to sign up for. So the Champions Programme we designed was all about building relationships with the individuals that signed up. So when someone signs up as a champion, we'd reach out to them, get to understand what they wanted to get out of the programme. But within that, we also wanted to make sure that we maintain that contact going forward. So once you become a champion, we can continue to support you in that role. For our champions, we also host quarterly virtual forums, bringing together all the champions. This creates the opportunity for sharing of best practice, but also to bring any issues that they might be having within their role. So potentially any challenges within the setting they're operating, they can kind of share those with other champions, kind of look at ideas to overcome those. We also wanted to make sure that we provided ongoing support to our champions. This was in the opportunity of regular check-ins about the champions' individual well-being, but also about the role they're doing. As a regional hub, we wanted to make sure that we could provide this support. So essentially, by creating this champions program, it was an extension of the network, making sure that we could continue to support individuals working in this area of work. We also want to make sure we share relevant resources with our champions, anything linked to sport, physical activity, and mental health. And in some cases, we've recommended training, particularly when there's funded training has come available. We'd make sure that our champions are the first to be made aware of this. So although all champions get access to the e-learning that Karla mentioned earlier, we also look for additional training that was available and made sure that we plug this into our champions whenever possible. And then finally, we want to make sure we listen to our champions and respond to any support they feel is needed. So even dating back to our very first virtual forum, we use that as a bit of a sounding board from our various champions to feed into what they wanted from the programme. And that's still ongoing. we want to make sure that this program is actually meeting the needs of the people that sign up to it. So we very much kind of listen to our champions and embed that in our approach. As I put there, we engaged 25 champions, and our champions have taken on various different roles within they do in terms of the settings they operate. But I wanted to highlight some of the different ways that our champions have fulfilled their roles to give a bit of an indicator of what can be achieved through being a champion. So firstly, actively promoting mental health in sport and physical activity settings they're involved. So if you're an activity deliverer, there's an opportunity to do that as a champion, whereas others have worked with their clubs and groups to support members to improve their mental health through sport and physical activity. Some have supported people who are experiencing mental health problems to start a new activity, get back into activity, or continue activity. And others have also been a point of contact for those experiencing mental health problems within a club, essentially making it everyone aware that they're the champion and they have the training available should anyone be struggling with poor mental health. A lot of it has been about encouraging and promoting conversations about mental health, as well as making connections with mental health organisations in the community. Some of our champions have connected with local minds and even developed this as a referral pathway for potential participants to attend their sessions. Finally, we've also seen some opportunities, or not necessarily opportunities, but some examples where champions have taken the learning to then signpost those in their clubs that might need additional support. We also provide our champions with a workbook, which includes a wide list of signposting services to make sure that those that might be struggling with poor mental health get the support they need. Essentially, over the course of the Champions Programme, we engage with people from varying roles, but we felt by creating an environment for like-minded individuals to be part of a wider network has been and will continue to be impactful. Sorry, I'll move on to the next one now. So mental health events there. So as Karla mentioned in her bit earlier, the hub has delivered over 50 events. And I know in the Eastern region, we must have accounted for a strong proportion of these, whether it be the conference such as today or other events where we have brought a mental health focus to our work. Examples of this have included our female mental health in sport and physical activity wellbeing that we held as part of a This Girl Can campaign, hosting opportunities to enable the sector to learn and develop how mental health is considered within physical activity settings has been important to us as a network, which is why we've delivered so many. In terms of embedding mental health understanding in the region, it's probably something that's hard to measure, but from what I've observed, having been in this role for about 2 years now and speaking to partners, I feel there is now a great understanding within our sector about mental health. I also think that this understanding is leading to positive impacts, with more organisations, sports clubs and activity providers using this knowledge to know what signs to look out for if someone might be struggling with poor mental health. But as well as this, I think there is now a better understanding about the approaches that can be taken to make activities more welcoming to people with some of the mental health conditions discussed today. For as much as it is important to raise general awareness, I also think there has been an increase in understanding about these tools available. So whether it is the mind sector support that Karla mentioned, or the mental health e-learning and more people undertaking that as a result of the regional networks, or even the support service available such that people can be signposted when they're in need of additional support. That's actually a typo I put on my slide there because we've actually got over 400 people signed up to our newsletter. But when we first became the regional network, we wanted to create a newsletter because we was getting a lot of information from Minds, and we wanted to make sure that this was getting circulated at a local level. And we've maintained this newsletter over the 4 years, providing the sector with national and regional updates specific to mental health information. And as I put there, or didn't put there, the newsletter has now grown to 400 subscribers. Finally, before I go back to Karla, as a group of active partnerships, we'll have at least some capacity within our organisation focused on mental health and connecting physical activity within the health sector. Although this typically looks different from each county to ICB area we operate in, I feel like progress has definitely emerged throughout the region over the last 4 years we've been the regional network lead. Examples such as Karla touched on earlier about Active Norfolk's All to Play For, where they demonstrated the impact physical activity delivery can have within the health sector, particularly that was delivered on for patients that are on waiting lists for talking therapies and the impact that that delivery service can have. Whereas in other counties, we've seen approaches have taken a different approach, such as working with public health teams, looking to get physical activity included in mental health strategy locally, or generally looking to connect the sector to physical activity. Overall, I'd say the work that the Minds and the Active Partnerships have been doing through the regional networks, and I'm sure will continue to do, is leading to better integration of physical activity with mental health services. I'll now pass back to Karla to do the next slide.
All right, thanks, Tom. Brilliant. I mean, 400 sign-ups to a newsletter on a regional level is amazing. And it's just been great to kind of follow that journey over the past 4 years and see the great things unfold. I guess in terms of what's next, you know, we've just seen such an impact from the regional hubs. It's really opened our eyes to what's happening locally and regionally. And we definitely don't want that journey to end there. It may be the end of the programme, but the journey will still continue. So past 8 months, us and the 8 partner hubs have been developing a legacy for the programme, which includes increasing support for the Active Partnership Network. So they're in a position to support local clubs and organisations. We will run a twice yearly community of practice for active partnerships, where we can still continue to hear about the local regional mental health needs, share best practice, and really help to understand where we can support as a national charity. We'll also have to continue to explore training needs of the sector, such as new resources, such as spot support signposts, which we've recently released, but really understanding actually what does the sector need around training, and what can we support with. We also want to increase the visibility of local to regional programmes. So through our national newsletter and through our Sports Minds LinkedIn, we want to really highlight what's happening locally and regionally. So we will be reaching out to the hubs, but also do contact us at sport@minds.org.uk. Let us know what's happening, and we'll do our best to kind of promote that on a national level. And just before I finish, and I think James alluded to this in the first webinar, but we are a small team of 9, but we really want to continue to provide support through our universal offer, for our sector support. So do reach out to us if you have any questions or you need support. As Tom said, many of the hubs will be continuing elements of their network. So it might be worth reaching out to your Active Partnership in the first instance, but please do drop us a message and contact us. There's a bit of a URL or code that you can access on your phone there. I'm not very technical, but I think if you hold the phone over the front, you can sign up to our newsletter. So we'll be updating our regional network page, but also including like animation of exploring the impact of the programme as well. And then just a final pitch to our self-care library. I think we're all very busy like looking after the participants in our sessions and supporting their well-being, but it's also really important to support yourself in terms of self-care. So please do, if you have 5 minutes with a cup of coffee, click on that link and just do a bit of mindfulness after quite a long conference today. But yeah, I guess, you know, it is the end of the conference today. It is the end of the Regional Network programme, but please, you know, work with us to continue the fight for mental health, because it's so important. But yeah, thanks, Tom. I'll hand back over to you to wrap up the conference.
Thank you. Thank you. So yeah, as Karla said, last thing from me. I think kind of echoing what Karla was saying, each active partnership still has a mental health lead. So I'd encourage you to connect with your local active partnership at the first instance. And also as a group of active partnerships, we're going to continue to meet and make sure we continue to stay connected and share the best practice, because we've seen that that's been really impactful over the last 4 years. And if you're an organisation and you feel like you have something that potentially could be of value for all the active partnerships in the East region, there's the opportunity to attend one of those meetings. Just reach out to me. In terms of what else we'll be doing going forward, we'll be continuing to work with Mind, as Karla mentioned, working on the legacy plans as these develop, and we'll be sharing details through our channels as these become clear. And I know there's some exciting plans around an animation coming out, which we'll make sure is included in our newsletter. We'll also make sure we attend those community of practices that Karla mentioned, looking to represent local needs and feeding in what we're noticing in the region. And then finally, I spent a bit of time on my previous slides speaking about the Champions Programme, because that is something we're going to continue to run as a region. We're passionate about the impact that this can have, so we felt that it was important to continue it. And hopefully some of you that have attended today will be interested in this and might take the opportunity to sign up to this programme. So I think that kind of concludes the webinar for today, and potentially we might have questions if we go to that. Give people the chance to do that if they have any. But we have, oh, is there any? I don't think there's any from ours, Karla. So I guess the final thing today is just to thank all of our speakers and thank you for everyone who attended. When you leave the session, there will be a feedback survey popping up. So if I could encourage you all to fill that in, it's really important to make sure that future events we run are meeting the needs of the community. So if you could feed that in, that'd be great. But apart from that, thank you for everyone attending, and I'll let you go and get some lunch.